Good afternoon. I'm Warwick Sabin, Executive Director of the Society of Fellows, and it is my pleasure to welcome all of you to this SOF digital discussion. I hope you and your loved ones are healthy and safe, and I want to thank you for being a part of the Society of Fellows. Your membership directly supports and sustains the work of the Aspen Institute, and that support and that work is more critical now than ever before. And we're very pleased to have Kyle Dropp as our speaker today. Kyle is the co-founder and chief research officer for Morning Consult, a global data intelligence company delivering insights on what people think in real time. He co-founded Morning Consult in 2013 and leads the company's research division, including its relationships with more than 250 Fortune 500 companies, media organizations, and industry trade associations. Today, he will share the results of his most recent public opinion surveys that provide some interesting and sometimes surprising insights about our rapidly evolving circumstances and the political and economic impacts we may expect in the coming months. And as with all of our SOF digital discussions, Kyle will be glad to answer your questions after he makes his initial presentation. And you can submit your questions anytime by simply clicking the Q&A button at the bottom of your screen and typing them in. And if you encounter any problems during the event, please email the SOF hotline and our team will be glad to assist you. So Kyle is going to present for the first 20 or 30 minutes, and then I will pose your questions to him for the rest of the event. Kyle, the floor is yours.
Hey, thanks so much for the kind introduction, and thank you for having me join. It's a real privilege to chat with the Aspen Institute. Personally, I've always been fascinated with what people think and why they think that way. You know, before Morning Consult, I'm from Wisconsin, and I was a Stanford poli-sci PhD, running lots of surveys there, and then taught for a bunch of years. And Morning Consult has given me and others an opportunity to understand questions about what people think at scale. When we started in 2013, we were running one survey every month, and then we kind of got together enough resources to do it every 2 weeks. And then all of a sudden we were running surveys each week. And eventually we started running interviews daily. And in fact, we're now running about 25,000 surveys every single day around the world. We have more than 150 employees. I think we'll probably do about 10 million interviews this year. We've released at least 100 studies globally on COVID-19. And I'm going to walk through a few of the most compelling findings that we've had in recent weeks. They're all available free of charge on our website, morningconsult.com, which will come up a little bit in the presentation. If we go to the next slide, I'm going to cover a few kind of key sections here. And if you move one more forward too, we're going to talk a little bit about sort of public concern with respect to coronavirus. We've got new info on that every single day. The huge political impact, nothing short of earth-shattering in terms of structuring how people think about the world and their leaders. And then third, sort of the economic and consumer impact. We've been tracking on a regular basis how people are changing, spending their time, their money, and their priorities. So if you sort of just get started and move ahead 2 quick slides, the first thing that I would like to highlight, if you go back 1 slide, is that we've been tracking this sort of from the get-go. So we've been looking at the pandemic since early January. This chart here shows how concern has grown over the past 4 months, I suppose, in the United States. Gen Z, these are adults who are 21 and younger, they're that green line. And you can see that in their level of concern, they are now catching up just in the past couple of weeks to some of the older adults in our sample. These are millennials in the purple, Gen X kind of in the darkish blue, and then baby boomers in the light blue. I would highlight a couple key dates on this figure. March 7th, Governor Cuomo declared a state of emergency in New York. March 12th, President Trump announced an address from the Oval Office that he would be suspending all travel from Europe to the US for the next 30 days. And we can see clearly a rise among older generations, and frankly, all generations during that time. Now, the concern, if you look at the next slide, is not felt the same by every single group. The urban-rural divide which this slide shows with urban residents, suburban residents, and rural residents, has really been emphasized throughout this coronavirus pandemic. As you can see here, urban residents, those living in denser populations or cities, I'm calling in here from Soho right now, have consistently had a higher level of concern than those folks who live in suburbs. That's that light green line, and especially higher than folks who live in rural areas, which is that blue line right there. The next figure, we'll talk about a little bit on face masks. So over the past 2 months, we've been asking people, whether they think face masks are effective at preventing the spread of coronavirus. So the share of Americans who believe that they are has grown significantly. For example, our data found that half of Americans actually say they haven't worn a face mask in public yet, with nearly 3 in 4 saying that they intend to start wearing the masks to some extent. So this is sort of talking a little bit about effectiveness versus behaviors. The next figure here highlights our work on social distancing. So there's a bigger discussion at the legislative level about how long to keep social distancing guidelines in place. And as you can see here, the first line, just 4% of adults that you talk to, the top left, anticipate that they'll be able to return to public spaces in the next 2 weeks, whereas about half say that it's going to be 2 months or longer. So that's that first line with those dark boxes, the share of people who say, they'll be able to stop social distancing in a certain time period. If you go at the bottom, and roughly every question we run, there are partisan differences. So you'll see large divides in expectations here. So 34% of voters who strongly approve of the president expect to wait more than 2 months, compared with about 62% who strongly disapprove with him. That's that bottom line way down there at the bottom. On the next slide, you can see that no matter what the income level or your political party, the voting public continues to worry right now about the coronavirus's pandemic impact on public health than its economic effect. So sort of the spread of the virus is that green line, and the economy is purple right there. So 3/4 of voters believe it's more important for the government to address the spread of the coronavirus than its impact on the economy. I imagine this might come up in the questions, but we'll be tracking this in the coming months as as certain states wax and wane, or all sorts of things happen, just for people to look at the comparative health and economic consequences of this. The next session here, to me, was really jaw-dropping. So the impact of coronavirus has restructured how Americans view their leaders at the local level, at the state level, at the federal level, and at the global level. I'm going to start with a figure on Trump's approval. So just last week, we saw, for example, for the first time in our polling, that more voters disapprove than approve of President Trump's handling of the coronavirus in the United States, with 49% disapproving and 45% approving. That's that yellow line with all voters over time, whether they approve. You can see moving from left to right, he generally received positive marks at the beginning, and it's consistently gone down about 30 points. So since mid-March, when we started this question, Trump's coronavirus approval rating has fallen 24 points among Democrats, and even 17 points among those who say that they're independents. The vast majority of Republicans have continued to rate Trump as well. That's that red line up there on top. If you go to the next slide, one of the most exciting things that I think we're doing at Morning Consult is we're tracking key economic and political and brand questions all around the world. And so if you look at our friends across the pond, United Kingdom Prime Minister Boris Johnson's approval rating, it hit an all-time high of 66%. That's that blue line, the day before he was released from the ICU. So this figure looks at our daily interviews of a representative group of residents in the United Kingdom, going from January all the way to the present. And we have this going back a few years, and certainly there's been some ups and downs, in that country. If you want to even broaden out and look from a more global perspective, I would say that this slide, to me, is one of the more compelling figures that I've seen in my time at Morning Consult. So what does this show? This shows the approval ratings for world leaders amid the pandemic since January 1st. I would highlight a couple lines. So right here, what we're looking at is the net approval for 10 leaders in different countries. First and foremost, I would point out Trump. President Trump is the orange line. It's kind of the flat one in the middle. There's relatively little rally around the flag effect for President Trump. He's up a few points in terms of his overall net approval. Of the 10 world leaders that we're tracking and releasing on a regular basis, only Australia's Prime Minister Scott Morrison has seen a larger rise in approval since the beginning of the year. The Economist even made a nifty chart of the day with this showing the change since January 1st. I would also point, so there's the line, the green line is Boris Johnson. Emmanuel Macron in light blue has sort of gone from the least popular world leader that we've tracked in any of our polling to now considerably higher. I would say the second at the bottom is Shinzo Abe from Japan, and that's a red line. He's seen a decline, in fact, in the last couple of weeks. It could show the implications of resurgences in cases combined with struggling economy. And the final line that I would call out would be this light green line. It's Bolsonaro in Brazil, who has seen roughly 20-point decline, and he has been sort of a public critic in talking about coronavirus and some of its impacts around the world. So the long and the short of it is, just about every leader in our international polling has seen some gain, with principally people who are not in his or her party coming and supporting them more. On the next figure, I would highlight some attributes that we asked people. So we asked a sort of a word or phrase to describe the United States' response to the pandemic. And you can go kind of from top to bottom. The top one is slow. So 53% said that. 50% said not enough is being done. And 50% said disorganized. So we have this in the United States. And I think this also helps explain some of the prior findings that I showed on President Trump and how people are seeing him. The next figure, I would actually say this is sort of the figure of the year of any that we've produced. So just this weekend, we saw protests against states' shelter-in-place orders across the country. But what we're seeing here on this figure is that governors who recognize the virus's threat and issued orders earlier, which is governors who are on the left, have seen bigger gains in their approval just over the past couple of weeks. So people overwhelmingly approve of their state governments, and we're not seeing these state protests represent sort of Republicans in the state necessarily. I would call out a couple here. So Ohio's governor, Mike DeWine, is up roughly 40 percentage points. New York, and my home state now, Governor Andrew Cuomo is up more than 30 percentage points. In our quarterly Morning Consult governor releases, Maryland's Governor Hogan has always been number 2 for the past couple of years. He is now number 1 in terms of the kind of governor with the highest approval rating of his electorate. And I would go to the right side, and I would show that Florida's governor, for example, has seen a decline in approval just over the past few weeks. So it can, in some ways, work both ways, but we were generally over time seeing large gains. If you look at the next slide, and we're trying to really dive in to net approval of some key institutions. So since the beginning of April, net approval, and by that we mean the share who approve minus those who disapprove, for the World Health Organization, for example, has fallen 29 points. This is the purple line right there, driven by a dramatic reversal among Republican voters, while the share of voters who blame China for the spread of the coronavirus in the United States has increased about 4 percentage points to be roughly 38%. So, we're going to continue to track not just leaders' approval, but all these other considerations, such as who people blame, how people describe their responses, of their state and federal leaders. I have a final section here that is going to talk about the general economic and consumer impact on voters. We have probably 30 to 40 studies that I won't cover here that do ask people when they're going to go to movies again, or amusement parks, or how much more time they're spending watching streaming, or which companies are up or down in the course of the crisis. I imagine I can answer any of those questions in the Q&A. But I guess on this first slide, I first wanted to talk a little bit about just overall levels of concern. So earlier in the pandemic, concern from Americans was focused on the impact that the pandemic might have on the global economy. This is that purple line. However, it's now shifted domestically to both the country's economy, which is this green line, and Americans' local economies. That's that shift right up in the purple line right there. In fact, this slide sort of looks exactly like that Gen Z slide I showed at the beginning, where sort of Gen Z is now as concerned as adults more generally. If you go to the next figure, we launched an entire economic intelligence product just a few months ago, where we're asking about 15,000 people around the world how they feel about their economy and their spending habits. And frankly, there wasn't a ton of change over the past few years, other than a dip in late in December 2018. However, now there's stratospheric change. So as I just mentioned, Americans are concerned about their local economies, and that's really reflected in consumer confidence. That is how confident people are in their economy. There's no better leading indicator of economic impact of COVID-19 that I know of than consumer sentiment. So here we're seeing that consumer confidence has dropped in every single state, from the left, which is February, to the right, which is March. And gray I would highlight is like a neutral rating. Blue is more positive, and red is more negative. We of course are tracking this on a daily basis. In fact, we just had an article out this morning that suggested that in some ways the declines in consumer confidence have plateaued, like it's not continuing to decline in the United States. Huge declines in March, but not as much in April. On the next slide, this sort of looks specifically at people's pocketbooks. So conversely, looking at savings, we found that 34% of adults in the under 50K income bracket said that they would run out of savings in 3 months if someone in their house had lost a job, while something like 20% said they frankly have no savings at all to fall back on. So this figure looks at all adults in households under 50K, households in the 50 to 100K band, and then households in the sort of 100K income band. On the next figure, we sort of extend that. And one of the questions in our consumer confidence indexes is a pretty straightforward one that gauges confidence to measure current buying conditions. So we define household goods here as whether people think it's a good or a bad time to buy furniture, refrigerator, stove, television, things like that. And for households of all income brackets, you've seen a decline here in sort of the percent of people who say it's a good time. You've seen an even larger decline in higher income households. If in fact, this isn't in the presentation, but if you were to take every subgroup and every combination of subgroup of adults that we talk to, the groups that have seen the largest decline in consumer confidence over the past 2 years are like millionaire Trump supporters. They went from sky high confidence to now, with all of the turbulence in the markets, considerable declines. If you look at this next figure, this is a figure that looks at the impact that consumers sort of have when companies sort of start layoffs. So our brand intelligence, where we track about 2,000 companies every day on a daily basis in the United States and a dozen countries, isn't yet showing substantial impacts on most brand metrics. And this is the share of adults who have a favorable impact. I would gather that this is likely because awareness of the layoffs and of alternative measures other companies have taken to avoid laying off staffs may be low. Once consumers have a better grasp of the magnitude and the repercussions of these layoffs and can start spending normally again, we'll see if their attitudes will pose any risk to these brands. And then I have a final slide that that I wanted to do, and that highlights some more of our international global confidence data. So you might recall the slide I showed showing global leaders approval. This shows global consumer confidence in the 12 markets. So since February 1st, 2020, consumer confidence has fallen most sharply in Japan. That's that far bottom line where 100 is the neutral rating and they're somewhere around 50. It has not fallen in France as dramatically as it has in some of these other countries. So we generally find that consumers' views of the economy and their own personal financial conditions are highly negatively correlated with the number of COVID-19 cases in each of these countries. And so, as the number of cases rises, you can see confidence falling. So for example, you see the decline at different time frames in different countries. India, which is the brownish line, sees a decline just in the last couple of weeks, and they all do. I would highlight, I suppose, that we do have daily data on China. This is this light blue number, and increasingly there's a gap between how confident people are in China and how confident adults are in the rest of the world. So we'll be monitoring this very closely to see if and when there are upticks in consumer confidence in any of these markets, and we're eager to see that. So what are we doing next? I think our current clip is probably releasing about 20 studies a week on all of these topics, whether it's economics or politics or just frankly how people are living. Some of the things that come to mind, if you go to the next slide, that we're really working to better understand is, will Americans remain patient and trusting of their government? If you go to the final next slide, will economic concerns begin to outweigh health concerns? You might recall the slide I showed that indicates people right now are focusing on stopping the spread rather than the economy, but that could change. How quickly will consumer confidence rebound once economic activity resumes? And then in which ways will this crisis fundamentally change the worldview of Americans, particularly younger generations who may have this as a formative moment in their upbringing? A final thing I would say is, for companies, for groups, for people, what is the new normal? Are people going to be expecting different treatment when they go to restaurants? Disposable menus, disposable silverware? Are people going to be expecting different sorts of experiences when they're shopping, when they're flying, when they're visiting hotels, when they're just walking around? And certainly we're working to do what we can to be on the leading edge of that and deliver info. So with that, we would be happy to take some questions from the audience now.
That's great, Kyle. Thank you so much. What an informative presentation. And we definitely have some questions already. I want to remind everybody that if you have a question for Kyle, simply click on the Q&A button that's at the very bottom of your screen, and you can type in your question. We'd also love to know your name so we can identify you if you're willing to do that. But Kyle, the first question I'm going to read to you comes from Paul, and he's asking, are your polls showing evidence of increasing polarization within the US during coronavirus? And is that something you can measure?
Well, that's a great question. On most questions that we ask, there are differences in how people who voted for President Trump and Hillary Clinton think about the world, and frankly, how Republicans and Democrats think. Right now, I wouldn't say that we're seeing increased polarization. We have, since the outset in January, seen that Democrats are more concerned about the coronavirus or COVID-19 than are Republicans. And that has maintained to this day, in fact, even through polls that we ran just a couple of days ago. I would also state the fact that polarization was quite high before the coronavirus. The difference in approval for President Trump between Democrats and Republicans, or frankly, the difference in approval between President Obama between Democrats and Republicans was huge and high to begin with. So in the current polling, I'm not seeing any indications of rises in polarization.
I see. And the next question is economic. Anne is asking, how does consumer confidence compare to confidence in the stock market? And why does there seem to be a considerable disconnect between the two?
Sure. So right now we're asking 5 separate questions about consumer confidence. Uh, 3 of them are more personal, and then 2 of them are about business uh, conditions as a whole. The first personal one asks people to look back and to say, how would you say you're doing today compared with last year? The second one asks people to look forward. How would you say that you will do in a year compared with today? That is always, even today, the question on which people measure the most optimistically on. People are fundamentally positive about the future. The third question that we ask is about buying conditions. So is now a good or bad time to buy large things? Again, that's fundamentally a personal question. The fourth question that we ask is more closely tied to the stock market. We ask a question that is like, in the next 5 years, do you generally think that there will be good times, or will there be times of prolonged unemployment? That question is the most correlated with stock market performance, but the personal ones have a little bit less association. The second thing that I would note is that not every single person in the country is following the stock market on a daily basis. When we look at changes in consumer confidence among investors or among high net worth individuals, it moves much more closely in line with actual stock market performance than folks who do not have money invested in the market. So I would say, one, some of the questions are personal versus more business centric. And 2, some people are more closely and regularly monitoring the market than others. And that's often tied to your income or your investable assets or your news consumption.
I see. And now turning to healthcare, Dr. Marla Kelly is asking, do you have any data regarding confidence and trust in healthcare practitioners? And do these data follow partisan or economic lines?
Sure, we have plenty of data on confidence in various practitioners. We had a survey out about 2 weeks ago, and we've updated asking people how much they trust various sources of information. And the 2 people who scored the highest on that were Dr. Fauci and the CDC. So people looked to him, and those were high readings, somewhere in the 75% trust range for both Democrats and Republicans for both of those sources. Now again, this is a fluid situation, and things could change. I think within the healthcare world, both today and previously, the reputation of doctors, of nurses, of pharmacists is generally off the charts and sky high. We have plenty of public polling on that to show that anywhere from 70 to 90% of Americans have positive views of each of these practitioners. And then I know that we have a few additional studies just on our site that speak to the specific sources as well.
Terrific. Moving back to politics, we have quite a few political questions. Someone asks, and you sort of addressed this a little bit at the beginning, but very, very specifically, is there a close correlation between Trump's overall approval ratings and the approval of how he has handled the pandemic?
There is. So I would say that they are highly and closely tied. Early on, as you might recall from the slide, Trump did receive a high approval rating for how he was dealing with the coronavirus outbreak in the United States. Something along the lines of 60% of people said that they had a favorable view. Now, we did not see concomitant increases in his overall favorability. Today, we see that Trump's overall approval for how he's treating the coronavirus is pretty similar to what his overall approval rating is among Americans. Both are slightly negative. I think he's about minus 10% in net approval if you look among Americans, and his overall approval for coronavirus is about that. I think to round it out, I would say that they're very highly correlated. With that in mind, you are also seeing that a lot of governors, as I mentioned earlier, are seeing huge spikes, both in their overall awareness and in sort of positive reactions to how they are treating these. So I think it does fundamentally shift probably how people are viewing their elected officials, and it does have the chance to reduce polarization.
Okay. This next question is sort of neither political nor economic. Isaac Siegel is asking, is there a significant correlation between the words Americans most closely associate with the virus and the prevalence of those words in the media?
That's a great question. I don't think we have wonderful data on that at the moment, but I can look into that and get back to you. I gather that perhaps how they describe it or how they say it matters. We've certainly seen that blame for China has gone up in the last couple of weeks, and I know that some people have described, have described coronavirus in different ways, just in a terminology sense. But we can provide more information on that.
Excellent. Back to politics. Sheraton Kaluri is asking that obviously in your data, proactive governors' approval ratings have showed gains. He asked, do you have any research that suggests a shift of voters' attitudes toward the role or importance of effective governance, or the importance of competence and credentials and qualifications for those who work in government?
That's a great question. I'm not sure we have anything on what people are thinking of government workers or people who, the millions of Americans who are, currently employed by the government. What I will say is that, fundamentally, most people are not spending 8 hours a day monitoring the news and reading 7 papers and doing everything that they can to get as much information about politics and government as possible. Now, the coronavirus is changing that a bit. Every single source of information that you might go to is covering it. Sports, which once was a way in which people spent a lot of time, no longer is a thing. So we are seeing among a lot of these governors that their overall name ID is going up significantly. So the people who are just not familiar with them or not looking at them or not seeking out information, them has gone down. For example, somebody like Governor DeWine in Ohio has seen a 15-point jump in the percent of people who are familiar with him. So I guess it's not a perfect answer to your question, but I would say that this has been a unique spotlight on governors and other officials and whether they can get things done that people care about. And if they can, it appears in our data that people are going to give them the benefit of the doubt and that they are going to approve of them even more.
Excellent. Mark Silverman is asking, how do Americans feel about the failure of the US to properly and quickly test for the virus? And how do Democrats and Republicans view this issue?
There's no surprise in our results here. Americans think there should be more testing, and blame for the shortage of testing falls along party lines that you might expect. I think Americans are eager to see more testing.
Mm-hmm. And then Amy is asking, is there data on people's comfort level to return back to mass gatherings, for example, church, weddings, sports events, concerts, things like that?
It's a great question. We had a study out that asked people 2 things: when they think they'll be allowed to go to certain types of gatherings, and 2, whether they would be comfortable going to such gatherings. Americans were most comfortable and they expected to get back soonest to things like going out to eat at restaurants. One notch down was things like going to the movies or going to the gym. And then another notch down, that is, people expected it to be some time off, were things like going to live concerts or going to amusement parks, in fact, or even going to large political rallies. We tested about at least 20 unique types of public experiences or events. And so I think if you Google morning consult comfort with going to events, there's all the info there, Amy.
Perfect. And we have a question from Alan Salisbury that you somewhat addressed sort of at the very beginning of your presentation, but specifically he asked, how does concern about the coronavirus vary by age group? And he put in parentheses, perceived vulnerability. If you could address.
Yeah, if you look in January and February, there were considerable divides with younger people less concerned than older folks. Just in the past few weeks, concern among younger folks has risen considerably. I would highlight kind of two other interesting findings. If you look at the beginning of the year, our consumer confidence data, that is how confident people were about the economy, didn't really show any differences by age group. Young people, middle-aged folks, older folks, all sort of felt the same about the economy. Now there's large gaps. Older folks are much less positive about the future, and there's a bunch of reasons why that is probably the case that I can delve into. The second thing I would highlight is that older adults have been much more likely to say they will or to obey various requests to stay at home or to not socialize. We have a lot of polling out that asks people the range of activities that they are currently doing, from frankly staying at home and doing nothing to going outside on a regular basis. And and older adults are much more likely to be the former, staying at home, than younger adults. It is worth noting that this is probably the news event of the century. So people are of course seeing the news and getting it, and it is changing behavior.
Absolutely. The next question is political. It comes from Garrett, and I'm going to read it, but then I'm going to interpret it. And if I get it wrong, Garrett, you can write back in and tell me. But he asks, in what ways has the Democratic nominee's perception been impacted by the pandemic? My interpretation is that that's a question about Joe Biden and the perception of Joe Biden and how that's been impacted by the pandemic. But if I'm wrong and he means how Joe Biden's own perception has been impacted, please correct me.
It's another great question. And there's sort of two things going on that can make that one a little difficult to answer. First, as you know, the primary contest between Democrats has essentially wrapped up, with Bernie Sanders dropping out. So, Joe Biden is getting a boost from those erstwhile Sanders supporters and is seeing consolidation from his party. We were seeing in some polling that a small number, a very small number, in fact, of Sanders supporters say that they would not cast a ballot for Biden. So he's seeing some boost there. Other publicly reported data suggests that in terms of share of voice, President Trump is orders of magnitude higher. It's impossible to compete with an incumbent president for actual press citations or other media metrics. But in the new normal that we have, which is all virtual, President Trump has far more Twitter followers, far more Instagram folks, far more followers on just about every digital platform than Joe Biden. So I think that accentuates just the amount in which people are seeing Joe Biden out there. But we are also tracking every single day, probably with about 6,000 interviews, what people think of Biden, of Trump, and in fact the head-to-head matchups between the two, and just about everywhere.
That's great. So we're winding down to our last couple questions, but again, I would invite anyone who has a question to submit it now, because we've got about 7 minutes left here, I think. But these last couple I save for kind of near the end because they're process oriented. The first one's from John. He asks, how do you do so many surveys per day, and where are you surveying people?
Yeah, another great question. So we've built this infrastructure so that we reach out to Americans on a regular basis. So we have partnerships with about 20 panels that have access to about 50 million Americans. So at any given time, we can reach out to all sorts of adults, and we're generally conducting these interviews online whenever we want. In general, we say, who is the sample of interest that we want to talk to? Like if we want to talk to Americans, we get the correct age and gender and education and regional estimates. And then we go out and interview them. And one thing that's wonderful is, over the past 20 years, the percent of Americans who are online has basically gone up to almost all, and more people are spending time online. So you can get effective representative samples of people. I think probably the final point that I would note there is, our goal is to get 10 minutes of as many people's time as possible, and and that is a pretty straightforward thing to do. Probably do about 10 million interviews this year. I'd say about half of those in the United States. And so I think there's never been a more exciting time to be able to be in this world of research, and to be able to, I think, get real-time information about things that people may not already know.
Right. And Caroline asks, what is the average sample size of your polls?
So we have a couple different types of polls. We have some that are always ongoing and that are tracking people's views of the world, and then we have some polls that we sort of release on an ongoing cadence. We have regular polls with Politico and the Hollywood Reporter and a lot of other publications that come out each week, and they have about 2,000 Americans. So that's a plus or minus of 2%. In addition to that, one thing that I love and that I think makes us unique is that we have daily tracking polls that have the similar questions each day. So in the United States, for example, we're interviewing about 6,000 people each day on one of our tracking polls, which is about 200,000 a month, 2.5 million a year. And then internationally, we also have additional capacity. I think our general view is that larger sample sizes are really helpful, because then you can understand underneath the surface what old people or young people or rich or less affluent or Democrats or Republicans or people living in my home state of Wisconsin think about the world. So we're always trying to be a kind of bigger and faster.
Terrific. Well, and one question just popped in. It'll have to be our last one, but maybe you can hit it quick. It's from Judith Barnard, and she asks, how frequently do you poll consumer confidence?
Yeah, so it updates every morning. So we're doing probably 15,000 interviews a day, and just like our other work, our goal is it should be always on and available for people.
Excellent. Kyle, this has been a terrific presentation. We really appreciate you taking the time and sharing so much fascinating data. Of course, it's likely to change tomorrow, but that's why you do what you do. And, as you say goodbye, please remind people how they can kind of keep track of the work that you're doing.
Thank you again to you and to the entire Aspen Institute community. I think if you want any additional information, our site is morningconsult.com. So morningconsult.com. And then we have 8 free newsletters that come out each morning, and that probably go to 300,000 plus people that I think are jam-packed with good information.
That's terrific. Well, I mean, as everybody could see today, you're doing a lot, and again, it's worth checking that out regularly as opinions evolve in response to the circumstances. So again, thank you for joining us. It's great to be with you virtually. I want to thank all of our SOF members who have been with us for this event today. I want to remind you we're doing these weekly. Our next event is next Thursday, April 30th, featuring Kara Swisher, the New York Times tech columnist, moderating a conversation with Tim Wu, the Columbia University law professor, talking about big tech. And if there's ever been a time to talk about the dominance of big tech and its role in our lives as Americans and worldwide, I think this is the time to do it. So it should be a fascinating conversation. We hope you'll join us next week. Until then, stay healthy, stay safe. Wonderful to be with you. Thanks again.